Hey everybody, welcome back to the channel as we take on another episode of The Pitt. I'm Dr. Todd, by the way. This is my wife, Allycia.
Hello.
If you're checking us out for the first time, thank you so much for being here. We would very much appreciate a subscribe, a like, a comment, help us grow this. If you're coming back, thank you for sticking with us. This, obviously, episode 9, 3 p.m. We're more than halfway through the day now, or through the work shift now. Episode 8 was horrific.
Yeah, it was emotionally horrific.
Yeah, no, the show is good. The mental or the emotional toll that took was horrific.
We got tissues this time.
Yeah, we came prepared.
Just in case.
Probably should have had that from like episode 1, honestly, because I mean, there have been a lot of really emotionally tugging concepts and elements here. Medicine itself it can be really emotionally draining, the loss of life in any capacity. But last episode we saw a child. I don't know how anybody can watch that and not feel that. So anyway, I'm really hopeful that they do not bring any elements of that back this episode.
I'm sure they'll touch on it. We can just pretend it never happened.
Yeah, because if they do, like, to borrow a line from my daughter, I think I'm going to crash out, destroy this whole thing.
Is that a new term?
Oh yeah, you've never heard that? It's like,
no. Mm-mm.
Yeah, it's like Riz and 6'7" and.
Well, I guess it makes sense. Oh, you say I'm going to crash.
Yeah.
So crash out,
right?
I get. Okay.
Anyway.
The action of crashing.
Hopefully no crashing out today. We'll see. We'll see what this episode brings. I don't know if there's a whole lot else to touch on from last episode other than how horrific it was. The Pitt won an Emmy. That's exciting. I think the actual show won an Emmy. I saw the actress who plays Dana, the charge nurse, won an Emmy, I think, for Best Supporting Actress. So awesome. Congrats to her and congrats to the whole cast and the writers and all that. All right. Well, without much further ado, let's jump in.
All right. Let's go. Oh, well, we're coming in to clean up. That's the room.
Yeah.
All right,
we're like 50% crashing out right now.
Can you just put him on the phone for a second? I just want to hear his voice.
Oh, he's got to call his kid.
There's my guy. How you doing, buddy? I would love to hear your song.
Yeah, I'm with Mel here. Let's put some calming music on. Some waves.
Ocean sounds.
You sure you shouldn't see your baby? I checked myself. Uterus is empty, barely spotting now. I'm fine.
She did lose the baby.
I think that's what it sounds like.
Losing a kid is hard on everybody.
Yeah, I think they're doing a good job just kind of showing that aftermath. Like, everybody needs something different.
And there's her mouth.
That's as hard as it gets. The kids you'll lose will linger. So what do? I did my residency at Big Charity in New Orleans.
New Orleans.
Big Charity.
I got a kid, 5-year-old boy, accidentally shot by his brother playing with dad's gun. Worried he was going to get in trouble.
The story for that began. New Orleans.
Right up until he coded and died.
Mm-hmm.
Oh.
Where do I put this feeling? And I found myself back at the gates of Big Charity Cemetery, and I'm looking at all those mausoleums and those crypts, and I'm thinking to myself, okay, well, that's what I need. I just need a safe place where I can put these feelings.
We got patients throwing punches in chairs.
Oh, wow. Okay. Well, that's a good distraction.
Like, yeah.
Right back to it. Right when he was about to emotionally open up.
Yeah. Well, we might have had a breakthrough there.
I know.
Robbie, critical case flying in, possible MDMA overdose, 5 minutes out.
I think they said NMDA overdose.
I asked her about it. She said she didn't want to talk to me about it.
Seriously? You just gave a speech titled How to Literally Bury Your Feelings.
Oh, how to bury your feelings.
No, don't tell me to calm down. How hard is it to put a mask on your kid? He has allergies, you fucking zombies. Allergies.
Oh.
I don't believe what I'm seeing. This is a hospital, for Christ's sakes. What's the matter with
This is
you?
an Emmy Award-winning Best Supporting Actress.
Yeah. She's showing its why.
All I did was offer to put a mask on her child, and now I'm missing out my goddamn...
Oh, so she offered to put a mask on her kid. I can relate to the mask thing a little bit. And if you want to write that down, I'll talk about that at the end.
Okay, Earl, let's take a look at you.
Red's got a left hook like Billy Conn.
Oh, so she punched him also?
I don't know. I think he was just kind of got pushed out of the way, maybe. I think she was just commenting on her punching ability.
I promise you'll be seen as soon as a provider is available.
Oh, wait.
There's no line. We see patients by severity of
she's
need.
probably
As
going
soon
to
as we
jail.
have your tests
Or
and labs,
maybe
you will
just
be
when
seen.
she was going to punch, like an elbow or...
I don't know, because they came out, he was on the ground.
What's up, Eric Estrada? Still keeping your eye on me?
Always, my friend.
That guy's such a douche.
Who's Eric Estrada?
Shame on you. Cheers. Know your television history.
You know who that is?
Yes, I know who Eric Estrada is. I'm only a year younger than you.
Well,
surprised you know who it is.
of course I know.
Seal with dental cement. Prescription for Pen VK. Soft diet. Follow up with the dentist in 1 to 3 days for a crown. You handle Spinks while I check on Ali?
You got this? Don't worry, partner.
Yes, totally got this.
Oh.
Patients are starting to see it.
I didn't even hit her that hard.
Too much almond milk in your soy lattes. That doesn't even make sense.
You know, most commercial almond and soy milks are fortified with calcium, so they end up having a higher percentage of calcium than cow's milk.
There you go, Mel. There you go. Hit them with the knowledge.
You got yourself a fight bite.
I didn't know you could get someone's tooth stuck in your hand from punching.
Yeah.
I guess.
I mean, teeth can rip through lots of stuff.
Didn't you have a tooth in your head?
I got bit in the head. It didn't stick around,
some
but
sterile saline into your knuckle joint. If it comes spraying back out of the bite wound, we'll know. Ready?
I guess.
There she
So that's bad news.
Yeah, got into the joint space.
You hear that, you fucking bitch? You gotta have surgery, thanks
Woman,
to you.
man.
Good. You assaulted me.
I think they wanted them separate, right? Like, this isn't exactly separate.
Call the OR, tell them we have a fight bite, then go take 20 minutes in the lounge.
A fight bite. Is that a technical term?
I've never heard it, but I'm
Okay,
assuming.
that's what they call it.
Oh, did you want me to tell the surgeons to go no mask for surgery?
Oh, yeah.
I want to respect your beliefs. So, what do you think? With or without for surgery? Without?
I want with.
Oh, really? Okay.
Near, please, overdoses here.
Pitfest OD.
Did they say what? Oh, they don't know yet.
No, I think it was that an MDMA overdose.
What's that?
I know it accelerates like your central nervous system. Like, I honestly don't know a whole lot
the
about
MDMA
it.
overdose. Dr. Mohan, how do you want to treat the BP?
Yeah, he said definitely an MDA overdose.
Seriously?
She might need another 40. Hypertension and tachycardia from MDMA, centrally mediated. Ativan is the drug of choice.
So much going on at once. I would crash out if I used that term right.
With what? Like all the trauma?
all of the overstimulation. I would just go into a closet and hide.
But honestly, that's usually what ER doctors thrive on.
I know.
That's why they go into it.
Not for me.
No, I need more time to like sit and
process.
Yeah.
I'm a part of the street team here. And I'll be honest with you, Piper. I think you need some help.
What are you talking about?
Oh, this is hard. She's trying to get her help.
Yeah, it's hard like when it's clear, it's obvious.
Yeah.
But as an adult, right, like you have the right to make bad decisions.
Yeah.
But if you could just take my number, okay? How about taking the pen? Call this number. It's a national hotline. There's somebody on the other end 24/7.
That's cool. I didn't know they had pens like, I mean, that makes sense to do that.
I want to go. Now.
Okay, I'm gonna count. 1, 2, 3. How long does she need to stay in the ice, Dr. Santos?
Till her temp is normal.
Wrong. You pull her out at 1 or 2. Was she sweating?
Profusely.
What if she wasn't, Dr. Santos? What if she was dry as a bone?
Then we'd have to think anticholinergic.
Anticholinergic.
Very good.
Well, little tension there.
Yeah. Do you think he knows that she's been questioning? I
doubt
don't
it.
know.
I don't think so. Not yet.
God, if he did.
Or maybe he picks up on that she's treating him a little differently, though.
Mr. Kokosch's asking to see you.
The guy who peed on me? Why me?
I did.
So I feel like we haven't had a lot of Whitaker lately.
I know.
Rubs on until after you.
That's a good idea. Oh, man, we got a load of the...
Oh.
Yeah, I see you. Days are numbered, buddy.
Lady had her seatbelt on, clipped the guy with the dog, and went straight into a telephone pole. Complained of chest pain, sleepy but arousable. Heart rate's a bit tacky.
She had like a seizure or something.
Maybe.
Yeah, gonna hurt.
Witnesses say she was driving erratically before the crash. No ETOH on her breath.
It's not drunk.
Core tabs 104.2. Heart rate 116. BP 180 over 110. Better, but still too high.
Another 4
Why are they ever in the
That'll make
ice?
20.
Good counting.
Why?
Yeah.
They said they have to get her core body temperature down
Oh, okay. I missed that.
to keep things from basically frying.
Okay. Ooh. Yep. Hurt your back.
Altered before the crash, good BP, but tacky.
Second line of...
Tacky. What's tacky?
Fast heart rate.
Oh.
That's 94%.
How about the city we're in?
Bruising on the chest. Possible sternal fracture.
Pericardium's clear.
She's a little tachypnic.
Tachypnic?
Fast respiratory rate.
Oh, okay.
Pan scan, head to pelvis, EKG, troponin, straight cath urine for UA and tox screen.
Agreed.
I'm on it.
Gotta bend those knees.
Yeah, Robbie needs a break. Needs to do some yoga.
It's a 10-day course of doxycycline, 1 pill twice a day.
I'll make sure she takes it on a full stomach.
I want to know the rest of the story.
Well,
it's weird.
And this woman's awfully sort of almost antagonizing, like intentionally antagonizing.
Yeah.
But like smugly, you know?
Yeah.
I come bearing gifts, everything you always wanted to know about STIs, but never wanted to read.
I think we're good. Learned my lesson. It won't happen again. I guess that's it then.
Well,
Yeah, she is very
change your
smug.
mind, comes with the free pen.
She's gonna take the pen.
It takes a few visits. How can I keep her
Sounds
here?
like they've done this
You got
before.
anything? Every Kiara has a social services card to play.
Well, they've certainly seen it before.
Yeah.
Ooh, this might be a road rash record. We might have to bust out the tape.
I'm getting a little worried about Crosby.
Who's Crosby? His dog.
My dog.
We got a lot of dog lovers around here. Still my Sunday morning soundtrack.
Ooh,
sorry.
yeah. Let's just push the rocks further in there.
Got a little distracted.
A topical anesthetic to
That does
numb
look
the
super
raw skin
painful.
before you start picking out all the gravel. Now you can tell people that you got hit by a car. Not a lot of people can live to say that.
Yeah, I hope whoever hits
I was in a roller coaster accident.
Mm-hmm. You write that down?
If you want.
Flag on the play. Positive pregnancy test.
Oh, she's pregnant?
No, she delivered a healthy baby here 10 days ago. Normal vaginal delivery, no complication.
Interesting.
So, postpartum complication.
Oh, man. She was seen
Okay.
here this morning by Dr. McKay.
Oh.
For what?
Urinary tract infection, discharged with oral antibiotic.
Oh, there's our friend.
Okay, so I need to talk to you about something.
He's
Do
like,
me a favor. Look at me and don't turn around and just
What-
walk
what do you-
straight into.
when
I
you
told
say-
you not to turn around.
what do you think that she's gonna do? Would you say don't turn around?
Yeah, seems like that should have been handled differently. Except for
It was like someone doing show hands, like, look here.
he seemed pretty amused with himself, though. So perhaps it was intentional.
There are limits to what we can legally do, but I can try to talk to her.
Hi, it's Dr. McKay again. Can I come in?
And she's gone.
Sorry. I think Piper took a pen.
She took the pen.
Took the pen. I know it's hardly a consolation prize, but
I know.
at least she planted a seed.
Why's she seizing? Febrile seizure? No, her temp is down. Maybe she needs more Ativan. No, she's had 20 already and her vitals are stabilizing.
Maybe hyponatremia, low sodium.
She needs saline. We don't have her Lasdaq yet. Drop 100 cc's of 3%.
It's probably different. I try to drink Gatorade in the morning so that I don't get enough sodium.
Yeah, because the electrolytes keep fluid in the vessels, so it keeps your blood pressure up, keeps you from getting orthostatic, as we call it.
Yeah, I used to get real dizzy
Although
while I was working.
I don't know that I would give 3% saline without a sodium level.
She's doing it anyways.
Serum sodium is critical, only 112.
Okay, so now,
Okay.
yeah, 112. So it's
Yeah, but she
very
did it
low.
before she got that.
Why did you not come get me? Hello, I was across the hall. I was 30 feet away. What is?
Is that what you should have done?
I don't think there was a whole lot of time there.
I know.
That did the trick.
Again, why did you not come get me?
Kind of had to act.
It was my fault.
Wouldn't he have heard a call?
I mean, I don't think they do rapid calls in the ER. It's all pretty much rapid calls in the ER.
Is it hubris or ignorance that makes you think that you know more than other residents that have 2 to 3 years more experience, and not to mention the over 500 hours of advanced training?
Is that crashing out?
This is a crash out.
Stupid or arrogant, you need to realize
And
that you are a beginner, which means your
extremely
job
inappropriate.
is to shut up, listen, and learn.
Oh, buddy. That is.
Dr. Langdon,
Yep, it needs to be put in
is
check.
the patient stable?
I hope there's an apology after this.
I think
Probably
Dr.
not.
Rob is going to show him how it was supposed to happen.
A list of
Stop
She was giving
talking.
unsupervised.
Knock it off. Shut the fuck up.
Everybody's silent.
No, he's crashing out.
Let me just tell you, harassment has zero educational value. This kind of behavior will not be tolerated.
I'm sorry, it won't happen again.
Where's your other one? Where's Mel?
Your other one is.
So like he's the senior, like
Okay,
they're
alright.
his juniors.
Honestly, they were trying to save the patient. Like, what? I mean, there was only so many of them.
Yeah, obviously it was very quick.
Yeah.
Better safe than sorry.
Sorry I took off like that. I have a thing about rats and cows. Totally freaked me out.
It's interesting to bring up cows.
Just getting them all out there. No. Wade doesn't try to take her on a date to a dairy farm.
Let's hope Mr. Kokoja is now too.
Yeah, no kidding.
Oh, man. He is garbed up.
It's hard to blame him. I mean, he's had about every bodily fluid you can imagine.
I know.
I just wanted to say sorry for earlier. I go out of my head when I'm off my meds.
I'm pretty sure the meth doesn't help.
I'm not using it anymore. I take antipsychotics for the schizophrenia I got from doing meth, but I've been clean a year.
Oh.
Why aren't you taking your meds?
It's cost money. I don't have insurance. Should I go on?
No.
Oh,
He looks like a little kid.
I know. I'm just thinking that.
He's so young.
Is that a sign we're just getting really old?
I mean, probably, yeah.
He looks like he's like 15.
Well, I never really had to worry about that. I started losing hair and graying at like 17. So.
This must be Crosby. I heard a lot about you, buddy. That was my least problematic trainee. What?
Okay.
It's kind of a compliment.
A little inappropriate again.
How you doing?
It's the little girl and the sister's just too close to home.
Yeah, the sister, the horrible actress.
If you're ready, I need you. I've got 1,000 pieces of gravel that need to be plucked out of a 2-foot-long road rash.
No.
1,000?
Man.
Make it 2.
He's piqued her interest. God, he's so like hot and cold. He's just wound up.
Yeah. Yeah, he's an interesting character.
That's a lot of gravel.
That's a lot of gravel.
Like hang out to decompress after a shift, right? You think?
I'm all about a long hot shower, comfy sweats, eating some takeout in front of the TV, ideally watching something that makes me laugh.
Was he trying to Netflix and chill with her?
I'm not imagining it in my mind. Of course, I just mean that I can see
I'm not imagining it in my mind.
All the while, patient gets front row seat to this. How will this do for patient satisfaction?
He seems interested.
Entertaining.
Help me get the lay of the land, so to speak.
You asking him out?
No. What? No. It's just that I'm new here, so
I don't date people in the workplace.
What was the response? Like the response was very.
First off, Mateo, you're fumbling badly. Second off, she's a med student, and so she will not be your coworker.
Likely.
Right.
Well, her mom does work at the hospital,
but-
so. And now she's left with the awkward.
Feel like I'm watching a rom-com.
Just came by to see if I could take Dr. Giovanni on a reconnaissance through chairs.
Yes.
Did she hear it all going down or something?
I doubt it. She's just here to bring peace, remember?
Yes. Oh, he's looking at him like,
He's like,
what'd you
"Come on,
just
man."
do?
You okay?
See, she knew. She
Oh,
could
maybe.
feel it.
It's like my parents once took me skiing in Utah. No matter how hard I tried, the altitude made me awkward. And I'm a very good skier, but I spent the whole vacation just like on my butt. But I was like a human Utah.
I've worked with a few Utahs. I wish you many, many Utahs in your life.
Am I your Utah? Wow, take that as a no.
That's a weird thing to say.
Oh, well, whatever. That means yes.
With a concussion, sometimes you don't remember, but your head CT doesn't show anything serious.
She still seems a little out of it.
Yeah.
How's your baby doing?
Maybe she's just getting zero sleep.
But, yeah, I don't know. Like, her oxygen was a little low.
I was your doctor this morning for your bladder infection.
Still tachycardic 115, BP's 124/78.
But she could be tacky from the sternal fracture.
So tacky from the fracture pain.
Hurts when I breathe. Let's try 4 more.
Hurts when we breathe, which also could be from sternal fracture.
If I had to have gravel meticulously picked out of my leg, this is the person I'd call. Dr. Mel King, detail specialist.
Detail specialist.
Hello? Can you hear me now? Huh? Hello?
Talk about someone that's wound up tight.
Yeah, he probably just needs to be escorted out.
Hey, like most of these losers, and I pay my taxes, which pays for them to not have any insurance.
Okay.
I'm leaving.
You are absolutely free to go, but if you do, you will be leaving AMA against medical advice.
And insurance won't pay for it.
Yep. And most insurances will not pay for it if you leave.
Sounds like a CYA form in case I drop dead on the curb.
That's exactly what it is.
Yeah.
God, this guy, man.
We are not back here playing Go Fish.
We're doing our best to help some very sick people. You will be seen, okay?
Well, he has been seen. He just put him back out in the waiting room.
Yeah, and he didn't like that. Which,
Robbie's gonna love that patient satisfaction score.
Crazy people.
I guess you can't just send him home and then they can call him back if...
You would know. No, absolutely not.
Between the hypothermia and the seizure, she's going to be out of it for a while. A similar thing happened to a friend of mine.
What was the hyponatremia caused from? Just
From pretty significant dehydration, like sweating all day but not replacing electrolytes.
nothing to do with drugs.
No.
Oh, okay.
No.
Like it's not just like a drug overdose that
No.
resulted. Okay.
And then sometimes if you drink too much, like water, like too much, something called primary polydipsia or something like that, you can actually dilute your sodium just by drinking too much water. That's pretty rare.
Yeah.
I've heard worse. Well, for what it's worth, he's wrong. You're very good at this. Thank you. It's actually worth a lot.
Yeah, she seems like she cares a lot. She's a little impulsive, but still was not appropriate what he did to her.
I'm still clear. No tamponade. Good EF. Lungs are up.
This one's weird.
We'll check a temp. Meds are on board.
I was thinking maybe like could have been like an amniotic fluid embolism or something, but it shouldn't
Yeah, but
cause.
10 days postpartum.
Well, and it really shouldn't cause all of this. Like it could cause you to have low oxygen, high heart rate.
If this is sepsis, where is it coming from? What's the source?
Urinary tract infection.
She doesn't have one.
She did when I saw her.
It's not a UTI.
Maybe like a endometritis.
Endometritis. The CT of the uterus shows a thickened endometrium, but that's normal postpartum. No retained POCs.
What's POCs? The retained POCs.
Let's see. Actually, I'm not sure.
Does that mean there was no placenta like stuff left in there?
I'm sure. Probably. I don't know exactly what POC.
Okay. You're not up on your gyne.
It's been a while since I've had to deliver a baby, like ever.
You haven't ever delivered one?
But no, it's not technically true. In medical school, you have to. But
yeah.
Yeah, well, we're on Liberty and there's Benedum.
The alley? I know it well.
So we could bring the meds to him?
Absolutely.
Oh, that's cool.
Positive urine this morning was contaminated.
Maybe.
Definitely. So clean catch specimen.
She was alert, walking, talking. It just seemed like a simple UTI.
She's struggling. She's got to figure out how she missed it.
Yeah.
Every postpartum patient needs a pelvic exam to rule out endometritis.
Are you saying I was biased against the patient because of her weight?
I raise it as a possibility, not as an accusation.
I mean, I really don't think that's the case here, but I will look out for it.
She took that really well, the criticism.
Yeah.
But it was presented calmly.
Yeah. I like
not
Dr. Langdon.
berating.
Yeah. It really is great that you want to help out. The street team get cool jackets.
Yeah.
You made it out unscathed this time.
Yeah. I'm joining the street team. Even get a jacket. So.
Now he's trying to impress her.
Very cool.
I'm going for a smoke if anyone asks. He's an emotional
support animal, I know.
Look, the friend's back. And the dog.
Drop it! Drop it!
Does he just take that off of a patient?
It's like a cop taking a car. Like, I need your vehicle.
Crosby, come here. There you go.
Wait. Oh. No.
It's like,
oh, they're all clapping.
but they all don't know. It's like they look
They're
like. Should we?
That's a little disturbing. Okay.
Dr. Robbie, Dr.
You got a
Langdon
rat,
appreciate it.
didn't you? Yeah. He does that.
Yeah. He just went. Or, I
Yeah.
don't know. Like he's done it before.
Well, I don't remember where he's from, but did he like grow up on the farm or something?
Well, he said there were a lot of cows and rats
So
or
maybe.
something. I'm surprised.
Hard at work? I'll take my chances.
Wow. Okay.
Wow. Okay. That's one way to end it.
My God. We went from
Yeah.
emotionally distressed in the last episode to
rage.
like adrenaline this entire episode.
To crashing out.
Yeah.
Okay, yeah. So this was. I'm noticing. These episodes have themes, clearly, underlying themes, and so like last episode, it was mostly about. It was like the really emotionally challenging, like the hardest parts of the job, from the emotional standpoint. And this episode seemed to be a little bit maybe more about like some of the maybe risks of the job, maybe even like personal risk from say violence, or you have residents tearing into other residents, and so like, and then of course the one like registration lady made the comment, I think like more than once in this episode, she said crazy people. So that I think this episode, I know it was titled 3 p.m., but it probably could have been titled Crazy People.
Yeah.
Because it really highlighted that. So I don't know. That's kind of interesting. So anyway, we ended with assault and battery. So hopefully this guy's in jail.
I will say it was more entertaining to me than a child's death.
Yeah, I mean, it's well, we can talk about it.
I know. I didn't even talk about that one.
Yeah. So I hope we get to see like the conclusion of some of these sort of side stories, though. Like
I know.
so
Well, we got some episodes to go.
I know, but like the trafficking victim, like it'd be really nice to kind of see where that, like, hopefully we get some resolution there. This guy should be in jail, so hopefully we get to see that happen.
Yeah.
I know there'll probably be some full circle things, I'm sure.
He's probably going to have a heart attack and die on the sidewalk.
Well, I don't hope he dies, but
I know.
Although I didn't write this down, but I'm going to touch on that a little bit. So, like, the fact that he was put back out in the weight room after an EKG and troponin, it does tell you though where they sort of triaged him.
Mm-hmm.
They did not feel that this was like an acute coronary syndrome or like legitimately a cardiac issue.
But they have to wait for the troponin.
But yes, and they wait for that because you have to check. So the reason for that, and I don't know if we've addressed this in any maybe earlier videos or in the podcast or not, but troponin is an enzyme that gets released when there is damage to the myocardium, like to the heart muscle, and it rises, in such a fashion with the degree of, say, injury. If let's say you just had a heart attack, the troponin is likely going to be normal, but several hours, it's usually, I think, 4 hours. I think that's kind of the protocol. 4 hours later.
That's why they were waiting on the second troponin.
Yes.
They said, okay.
And sometimes you'll even do like sometimes you even check additionally, but with these quote unquote high sensitivity troponins, you can check, say, 4 hours later, and if you see a rising troponin, then that is concerning. Like that could mean what we call an NSTEMI or an non-ST elevation in MI. And the definition of that is the troponin elevates, but the EKG looks normal. Because obviously, if you come in with chest pain, you do an EKG and it shows what's called ST elevation, that's somebody who's having a heart attack. So that's getting whisked back into the cath lab. This guy, if his second troponin was elevated, they would probably be doing a cath. So that's why you do not let him go home, because it could still be quite dangerous. But they didn't feel like it was so acute that obviously he had to, like, say, stay back in an ER room. Right now, if that troponin comes back negative, he's going home. Like, they're going to send him home, follow up with your PCP, so follow up with me, or see a cardiologist in the outpatient. So that's what the protocol is. He may not have liked that, though, because that doesn't necessarily give him the answer. It tells him that you're not having a heart attack. So now you need to go see your PCP to figure out maybe exactly why you're having this pain. So, but that didn't matter because he left and then decided to knock out the charge nurse. So we'll see how that goes for him. So the few things I wrote down, we'll kind of try to go through this quickly, not to drag on, but I wrote down big charity.
Oh, yeah.
So that is really cool. So I don't know if I mentioned this at all, but I trained in New Orleans, and I never worked at Big Charity. Now, Big Charity was closed down.
You see Dr. Robbie there?
Never saw Dr. Robbie. But perhaps that's why I have felt this strong connection to him. Because it seems like we've had similar trajectories, except for he's an ER doc and I'm an internist.
you were gonna be.
But I was gonna be. But so Big Charity was a hospital. There's a documentary out that I need to watch. I've been saying this for the last 10 years, called Big Charity, and it is about kind of the scandal, the corruption that kind of took place in New Orleans around Hurricane Katrina, and how it pertained to the hospital system. Big Charity being the oldest hospital system in the U.S., which closed down during Katrina and never reopened.
Why did it close down?
So it was sort of it was I don't know, destroyed, I guess, if you will. Like, it needed to be rehabbed and cleaned out after the storms, after Katrina. But then my understanding is it never reopened. And it was ready. They brought in the National Guard. They got it ready, cleaned. It passed all of these regulation standards for reopening, and then it never reopened. And then they just put the chains on and said, "Get out."
Was it haunted?
No, I don't think that's it. I think it was more just corruption and political manipulation and things like that.
Okay. I'm just curious.
We really, because I bet
it's haunted.
That documentary came out in, I want to say 2015, when I was actually living in New Orleans.
Didn't you say there was a wing in your hospital you trained in that was haunted?
So that was the rumor.
I mean, you were in New Orleans.
That was lots of voodoo and things like that. I never found it. I tried to find it. I never did.
You couldn't find the wing?
No, I couldn't find the haunted wing. But not for lack of trying. But that was not Big Charity, though. So,
okay.
Anyway, I wrote down Masking Kids. I know you wanted to talk about this.
Yeah, was it just you? Did you have something you wanted to say with it? Or
no, go ahead.
No, anyway, so it was when she said that her son has asthma, he can't wear a mask. And then the other woman was telling her to put a mask on her son because he was coughing. I would never go up to someone and say that. I think everybody makes their own decisions as far as what you need to do for your child. And we don't know. I mean, maybe she was like keeping him in a corner. I mean, I feel like that would have been, if he was coughing a lot, being appropriate. But I know we've mentioned before that one of our children is autistic. And I think during COVID, they were around 2-ish.
Yeah.
And they had severe receptive and expressive language issues. So language was just not there. So putting a mask on them was not going to happen. Mm-hmm. And honestly, I think the schools, they were accommodating for it. Mm-hmm. The hospitals, every facility we went into, we would try to put a mask on them, but it was just, there was no language for them to understand that that's what we do. I knew at one point we had to cancel multiple Disney trips.
Yeah, we were going to go
because
to Disney,
we couldn't
but
bring
they
them.
had their mask policy, which was apparently...
And I remember we fashioned like a pacifier. Yeah. We tried to do that to try to,
Didn't work.
Anyway, so there are circumstances, I feel like, where I can only imagine if I got approached like that aggressively.
Yeah. Well,
that I wouldn't have responded aggressively.
Yeah.
I wouldn't have punched somebody out likely.
Yeah.
But
well, yeah, I mean the lady who punched the other lady was clearly more aggressive, but yeah, if you're we didn't see the interaction, I suppose, but yeah, I guess maybe the moral of the story there is don't be so judgmental.
Yeah.
Like don't assume that I don't know that you know what everybody's situation and story.
I remember it was really hard to breathe in those things because I had to work and I meant like the hospital workers wear them all the time, COVID or not.
Yeah, now ORs are the operating room obviously where it is standard masking and it has been forever. Those the temperature of those rooms are turned down quite a bit, and of course you're gowned up. Sometimes you have lead on if they're doing imaging during procedures, so that probably does help a little bit with the comfort.
Oh, okay, that makes sense.
But I say that as never having had. I mean, I've obviously not worked in an OR, so I don't know exactly, but yeah, I mean, we obviously wore them in our office.
Yeah.
And it was not always comfortable, but all right. So the other thing I wrote down, kind of because you asked me the question, was didn't I have a tooth in my head?
Yeah.
So yeah, when I was a kid, I was jumping on a trampoline with a neighbor friend, and I got pushed. I want to say we both got pushed, and
so it was more than just the neighbor friend.
Yeah, it was like my brother and neighbor friend's brother, and got pushed sort of towards each other actually, and I happened to be jumping up as this individual was coming down, and got bit in the top of the head. Tooth did not stay, thankfully. But I had to go to the ER after that because it hurt, and it wasn't until I grabbed my head and then took my hand down and realized it was covered in blood. And then of course my mother was pretty dramatic. She wasn't usually a dramatic person with that stuff, but obviously blood gushing out of your child's head.
Yeah.
So they took me in, yes, because it was a human bite. I mean, they had to be careful with how it was addressed. They actually didn't suture it for that reason.
Interesting.
They think they did more of kind of almost like the Dermabond stuff.
Yeah.
And then antibiotics, all the good stuff. So fun story. I don't know not much to say about that. But yes, I guess the point is obviously teeth are very hard.
Yep.
You want to tell?
No, skip that.
Okay. So I wrote this down. This is just this was another kind of theme of the episode. It's been a theme of the whole season, honestly. The social workers and how much help they provide, the behavioral health support. So the whole team in medicine is extremely important. And I think sometimes that doesn't get acknowledged as much, and it should. So this is more just a comment to say shout out to all of those people, the ancillary sort of medical team that helps keep the engine going. So social workers, behavioral health specialists, our dietitians, our care coordinators, our care managers. I hope I'm not forgetting any like specific, all the way into like say the techs and the MAs and PCAs and all that. So the team is large, and they all have such a crucial role. And so shout out to all of you who do that. I wrote down Dr. Langdon. So he is an interesting character. He comes across extremely talented, in my opinion. Like, he comes across extremely knowledgeable. He clearly has like a good side, there's that good spirit there. He's great with Mel. He has a thing with Santos, and he's rough around the edges sometimes. He's abrasive at times. I agree completely with Dr. Robbie. Insults and all of those things are not valuable tools. It's not how you do it. If there is an issue, it should be handled way more professionally than that, because otherwise, like, you're really not even getting your point across, right? You're just making yourself maybe feel better because
and making them feel worse.
Right, like you flexed your, say, status of being a senior resident on her. But he's an interesting character. Obviously, there's more to that particular interpersonal drama there with Santos and him. So that will probably come out soon.
Yeah.
I'll talk about the last one I wrote down, and then we'll get to one thing you wanted to talk about. Dr. McKay, wrong diagnosis. This is always a hard one. I don't know if you said I'm not an OBGYN. Dr. Collins had kind of made the statement that pelvic exam every single postpartum patient, which makes sense.
Yeah.
Like, that seems logical.
Like if they come in the ER.
Right.
Yeah.
Like postpartum complication, that seems logical. But any mistake that you make, or let's just say wrong diagnosis, like that sticks with you. And it's unfortunate that it happens, but I can tell you that you're unlikely to miss that again. Because it will.
Yeah, she won't ever miss that again, right?
Sear into your brain. And you do that. You go through all the things like, what was the piece of the puzzle here that I perhaps missed? In this case, it may have been that she just didn't do a thorough enough exam.
Maybe ChatGPT wouldn't have missed it.
Oh, gosh.
I'm kidding.
We're going to go down that route. Stay tuned next time. Actually, we do have an episode on the podcast about that. Go check it out. AI in medicine. And then I wrote down pelvic exam. You seem to have a story here.
Yeah, but I don't think it's appropriate.
Okay. Well,
yeah.
So with that teaser,
we'll talk about it, then maybe next time bring it up.
Yeah. Gosh, now we're all intrigued.
Yeah.
So anyway, that's all I wrote down. Another really good episode. Thankfully, we can actually talk about it instead of the last one where it was sort of like just do anything but think about that.
Yeah, I think we were just ready to just put it out of our minds.
Yeah, and then they had to show the stupid bow. Anyway.
I know.
That's enough of that. We'll see. All right, guys. I guess we're getting ready to get into episode 10. Can't wait. Thanks for sticking around with us. Take care.
See ya.
I am Dr. Todd.